Okay, and welcome to our Pharm To Home segment this morning with Thomas McDowell, Rocky Mount Medical Park Pharmacy, and others. Tell us about your others.
Yeah, McDowell's in Scotland Neck. We've been there since 1901, and then we recently acquired a pharmacy in Gates County, up a little further northeast, and that's McDowell's Pharmacy of Gates County. So excited about the expansion, and we've got some great teams and great staff and great patients, so it's a fun and busy time.
Yes, absolutely. So what do we want to talk about today?
So, and I think the timing is good on this because it's been in the news a little bit locally, but going to talk about naloxone and really want to, cut through some of the myths and it can feel a little uncomfortable or taboo to talk about naloxone, because it's often directly correlated to, illicit drug use or overdoses, but
right.
it really can be used in a lot of different scenarios, and it's really something that I think should be in your emergency healthcare toolkit, so to speak. And there's a lot of different scenarios where it can be used, not just for maybe an overdose where you're thinking about certain drugs maybe on the street, but it can be used in prescription drugs with a lot of different scenarios. Even when you're taking these medications just as prescribed, there are certain situations where your body can have too much of that drug.
Okay.
So it's one of those things that is good to have at your house, almost like having your first aid kit.
Well, I know they've got them now on all the buses. I think it's 117 buses, they said. It's on in Nash County, it's on every bus now because they just felt the need, and it could really help if something were to happen. That bus driver, can act.
Yeah, and I think, we might be wondering, why is it needed on a bus? Well,
yes,
it probably won't be needed.
Right, and we hope it won't be needed.
It's like a fire extinguisher.
Yes.
Nobody's
hope you
planning
won't need
on
it.
having a fire, but it's good to have something just in case, because it's when you need it, and it can really instantly reverse opioid effects in the body. And
yes.
So it's become a lot more accessible, and the funding for a lot of the accessibility, and not everybody may know this, comes through the opioid settlement fund that was really stemming from kind of a federal level. There was a lot of lawsuits with some of the big wholesalers, and then also the big OxyContin, if anybody's followed that with Purdue Pharma, and so
right.
some money was distributed down to the state level and then really to the county level to combat opioid use.
Right, sure.
Primarily trying to provide support and resources for folks that may need it, and so that's, I believe, where the funding came from.
Okay.
From this initiative, but it's often in police departments and maybe fire departments. They always have it because they're first responders on the scene when there might be an overdose.
Sure.
But yeah.
How does naloxone work?
Yeah, great question. So it's a reversal agent, so it's actually a competitive antagonist of opioid receptors. So say that you are taking an opioid, and that opioid is binding to the opioid receptors, and that's how it provides pain relief. That's the intended mechanism when you're taking it like your doctor tells you through a prescription. It's also the mechanism for other illicit drugs that are much stronger at times, but also have that similar effect.
Right.
That are not used according to, FDA or prescription, directions. But that opioid binds to that receptor and gives you the effect. But when you do naloxone, and usually it's nasal, that naloxone kind of kicks the opioid off the receptor. and
Okay.
binds to the receptor, and it's like, hey, get out of here.
Okay.
I'm here, but it doesn't.
That
provide
makes sense.
It doesn't provide any of the side effects.
Okay.
So it doesn't make you drowsy. It's actually pretty aggressively reverses the effects to where you know, if you have shallow breathing, which when you have too much of an opioid in your body, you can have shallow breathing,
right,
really groggy, and it's quick. It reverses it really quick.
And especially now, what about with all the fentanyl? Everything is laced with fentanyl now, it seems like. What about, does it do anything with fentanyl?
It does. That one's really tough, though, because it's so potent in small levels, and we're not talking about patches that you're taking via prescription. Those are very well controlled, slow release, you know, under doctor supervision, you know, or not a huge risk of overdose or anything. But when these other drugs on the street are being, you know, laced with fentanyl, and it's not, you don't know how it's made, and it can be really dangerous, and it can reverse that. It's just you get to a quick enough situation, because it's very fast if you overdose on that.
And so you better get it
really
quick.
Dangerous, and you know, there's a lot of research and things going on, especially in Edgecombe County. The community paramedic program there is my friend Dalton Barrett is very active in helping folks in that community, in that county, and doing a lot of research on what is actually on the street, and sending it to a lab, and getting details around that, and how to help people. You know, because it is you know, it can be, those drugs can be addictive, and it's one of those things where it's really controlling your thoughts and your decisions. And they're very powerful drugs, but the naloxone is really accessible now. It used to be in the pharmacy prescription only, but we have a standing protocol through the state, and most states do nowadays, where we can dispense it without a prescription. But then recently, a year or two ago, it went over the counter. So you can just purchase it at the pharmacy.
Okay, so you purchase. I was going to say, how does insurance work with that?
That's a great question, because at times it was honestly more accessible in the pharmacy before it went over the counter.
Okay.
Because when it was prescription only, more insurance plans covered it. At lower copays, and then insurance plans, you know, are not looking to pay for extra stuff.
Right. Oh, sure.
And so when it went over the counter, they said, you can get it over the counter, we're not paying for it. And so it actually ended up raising the cost and, you know, unintended consequences of legislation to get it over the counter. Made it more difficult to get in the pharmacy. Now it's still widely available in communities for free usually. But we actually have a prescription-only formulation that we have access to that is covered by a lot of Medicare and Medicaid plans.
Well, that's good to know.
And so we can dispense it without a doctor's prescription. We can dispense it under our standing protocol and get it to you in 5-10 minutes. So if you're looking for it and you have Medicare, Medicaid, call us at Medical Park Pharmacy. If you just want to have it, even if you don't have to take an opioid or even know anybody taking an opioid to even get it. It's available for anybody, because you never know if you might come across somebody that may need that reversal agent.
Yes, absolutely.
And so we dispense a good bit of it, and we tell folks, you know, especially if there's somebody that is getting a brand new opioid through a prescription, you know, post-surgery, they've never had one. Well, you don't know how your body's going to respond to that. Let's get you some naloxone just to have. I tell folks, you're not going to need this. I'm not saying you're going to overdose on anything. But maybe you take an over-the-counter medication or start taking one that we don't know about, your doctor doesn't know about, that interacts with the opioid, and your body gets more of the opioid than expected. And you start having some of those groggy, shallow breathing symptoms. Because it can be dangerous, especially if you already have respiratory symptoms. The main side effects of that, you know, of kind of having too much of the opioid is really shallow breathing,
Oh.
where you can't even see their chest rise and fall. And they're going to be groggy, they're going to be sleepy, kind of out of it. Those are kind of those signs to look for. So it's something good to have,
Yes.
whether you take an opioid or not. And there's a lot of people that take opioids because of pain or surgery,
Yes.
or their back, or tons of different ailments and diseases that require the prescribed use of an opioid. And these folks know how to take it. Their doctor has them taking it a certain way as prescribed, but it's still good to have. It's like, I tell them, like a fire extinguisher.
Oh, yes. Yes. Better to have it and not need it than need it and not have it. Isn't that what they say?
That's exactly right. So yeah, if you do need one, stop by and see us. And you can buy it over the counter. If you just want to buy it over the counter. It's usually $40, $50 though.
I was going to ask you how much it was, $40 or $50. Okay.
And so it's widely available now. It really is, and it's a good thing to just have it out there.
Well, I think so, because you think about, all right, kids, grandparents, you're going to have a family gathering at your house, and 7 of your grandkids are going to be there, and you don't ever know. Teenagers, you don't know what they're getting into.
They might bring a friend over there.
They might bring a friend, whatever, and you don't know, and it's good. It would be good to have if you think about it. It really would. So. And
then if it expires, you can just come back and get another one. But yeah, like I said, Medicare and Medicaid often cover it. Your copay structure depends on deductibles and what your plan is. So it's not always free or anything through insurance, but some plans do cover. Medicaid covers it at no copay.
Okay.
So there's a lot of opportunity to get it with those plans, and then some Medicare plans cover it. Some of the big carriers cover it. Commercial plans are kind of hit or miss, but
right.
We offer that service, and some of the big box pharmacies are not really. If you go ask them, they might not be prepared to do that. I couldn't tell you for sure, but I don't see that they're actively kind of offering this service.
Yeah, I don't hear about it.
We kind of offer it as a service, and amongst other things, we can also dispense glucagon, which is a hypoglycemia, low blood sugar reversal agent.
Oh, okay.
So,
wow.
I may have touched on that a while back, but for diabetics, sometimes it's more dangerous when your blood sugar gets too low.
Yeah, I hear that. Yes.
Too high over time can be really dangerous, but too low can kill you.
Yeah.
Because you have to have some sugar, some glucose to function. Your brain needs glucose in normal levels. But the Gvoke is one that we dispense. It's a glucagon reversal agent injection. That's also under the standing protocol that we can dispense without a prescription. So pharmacists can do more and more these days, and we've talked about test to treat, where we can prescribe Tamiflu. We haven't rolled that out yet, but
that's so good that y'all can do that, because you cannot always get to your provider. You just can't.
And it's an accessibility thing. Primary care is super busy.
Yes.
There's a shortage of primary care providers.
Oh yeah, absolutely.
In the United States, and they're working super hard and on really tight time constraints, and a lot of that's because the insurance company is hamstringing them on their timelines, and so we've seen it be welcomed by primary care to have kind of some, like, if you're sick, go.
Yes.
Because they're already often sending them to urgent care or to the ER if it's something acute and severe. So if it's flu-like symptoms, we hope to be able to roll that out in the fall.
Is COVID, has it come back? I have looked. There was a lull.
Yeah.
And now it looks like it's come back. I looked on Facebook, and 3 people I knew said, "Oh, I'm down. I've got COVID." And I said, "Oh God, is it coming back?"
I haven't seen a ton. I have seen a little bit of uptick in some respiratory illnesses lately with, feeling blah and maybe having a low-grade fever and congestion. And we had a big spike, like in December, January.
Right.
And of RSV, flu, and COVID. And it seemed to kind of downtick.
Yes.
Leading into, March, but I don't know if it's the weather with some of the erratic cold weather.
Well, it could be.
They do kind of spread more in the colder weather. And we've seen more of an uptick with some more sicknesses lately. Hopefully we can get in the spring without any more
Hopefully so. But if you do need anything, you know where to go. Rocky Mount Medical Park Pharmacy.
Numbers on the screen. We're
yes, it is.
901 North Winstead, the big 5-story Boyce Willis Clinic, first floor, full-service pharmacy, serving the entire Rocky Mount area. Stop by and see us, and we do offer free delivery, pill packaging, vaccines, Medicare reviews, and so there's a lot that we can offer. So we hope that you'll come and see us.
They have great customer service there, so as you said.
Absolutely.
Go see them. All right, thank you, Thomas.
Thank you, Sandra. Enjoyed it.
Yes, absolutely. And Thomas will be taking a break. He is, he's got another addition to the family.
Yeah, baby number 3, a baby girl coming.
Congratulations.
In April, so I'm going to try to step back from a couple things and be present for that. And I've
absolutely
thoroughly enjoyed doing the show and hope to be back, in the future on this
absolutely.
Show. Thank you for everybody for watching and tuning in, and I hope it's been helpful.
We appreciate having you. We certainly do, Thomas.
Thank you, Sam.
And good luck with all the babies.
Thank you.
All right, we'll be right back with you with me and Roger.